Hello, everyone, and welcome to our question lab. We're happy to have you here once again on this Tuesday night at 8 p.m. Eastern Time. I know a lot of you are joining us from other parts of the world, and we're happy you're here as well. Tonight's topic, as you are aware, is psychiatry. Leading tonight's discussion is Dr. Paras Vicaria, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident at UT Southwestern here in Dallas, Texas. I originally graduated from pharmacy school in Missouri, went back home to Michigan to do medical school, and am now a dermatology resident. I'm also working as an RX coach with USMLE-Rx, so working one-on-one with students to help prepare them for exams such as the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
As you can see, our answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you are unfamiliar with, which may cause you to panic as you're trying to answer the question. So I've gone ahead and removed those for you now. After that, we will read the lead-in or the last sentence first. And the reason we do that is because we want you to know what the test writer is asking, so that as you are reading the vignette, you can pick up on all those relevant clues and not have to waste time and reread that question. So let's go ahead and read that lead-in now. Which of the following agents was this patient most likely prescribed after discontinuing sertraline? Which of the following agents was this patient most likely prescribed after discontinuing sertraline? After we read the lead-in, we'd like to ask our students how many steps they believe this question will require. An example of a one-step question could be where you ask for the diagnosis. An example of a two-step question could be where you ask for the treatment for a diagnosis. And an example of a three-step question could be where you asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. I see the responses coming in. Excellent. Let's read that vignette. A 46-year-old woman comes to the emergency department because of fever and muscle spasms. She has a history of refractory major depressive disorder, unresponsive to several drugs, most recently sertraline, which she stopped 2 days ago. She was switched to a new medication, which she started earlier today. Temperature is 39 degrees Celsius or 102 Fahrenheit. Pulse is 95 per minute. Respirations are 14 per minute, and blood pressure is 134/92. Physical examination shows a diaphoretic and agitated patient. Brisk and passive dorsiflexion of both ankles produces sustained clonus. Which of the following agents was this patient most likely prescribed after discontinuing sertraline? I want all of you to start thinking about the important clues in this vignette and the lead-in as I hand it off to Paras.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off with this question, demographics. This is a 46-year-old woman. It's always important to take note of the demographics because that's really going to clue you in into what you should be thinking, and it can help point you down the right track once you get to a little bit more information. Also, why is she coming to the clinic? Why is she coming into the hospital? Why is she coming to the ER? She's coming because of fever and muscle spasms. So also important to take note of why they're presenting, and oftentimes as well, they'll tell you how long it's been going on for, so the duration as well. Then they will usually give you medical history, and here they give us medical history, but they give us a little bit additional information. It's refractory, it's unresponsive to several drugs, she was recently on sertraline, they give us the fact that she was started on a new medication, they give us some timelines there, and then they give us some important vital signs and physical exam signs that we need to make note of, okay? So hopefully you guys agreed and also felt that those were important clues in this vignette. Now let's take a look at this lead-in. It's asking us which agent is most likely prescribed after discontinuing sertraline. So those are the important phrases in that lead-in, okay? So how many steps is this question? I I think it's probably two steps. I think one, we need to figure out what's going on in this patient. And then two, based off that, maybe what was the agent that was prescribed after stopping sertraline? So maybe a two-step question. One, what's going on? And two, what's the agent that they're getting at? So let's take a look at those answer choices. So we have 5 answer choices here. And what we recommend and what we're going to do today is we're actually going to start at the bottom, answer choice E, and we're going to work our way up to the top. And we recommend students do this because, you know, a lot of times we'll see students, they'll start at the top, they'll see something they like, and then they'll go ahead and select that. And then a lot of times they may get that question wrong because they didn't get through all the choices. So we recommend doing it this way to help avoid bias and avoid those mistakes. So let's go ahead and do that now. Answer choice E, tranylcypromine, D, mirtazapine, C, diazepam, B, chlorpromazine, and A, bupropion. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is most correct, and we'll talk about it in just a few seconds.
Excellent, thank you, Paras. So once again, the poll is open. We're going to wait until about 2/3 of you have responded before we close the poll. Remember that on test day, there is no penalty for guessing. You only get points for correct answers, so you should never leave a question blank. And if for some reason you're not sure about your answer tonight, don't worry, take your best guess. And as always, Paras is going to explain the correct and incorrect answer choices to you afterwards. I see the responses coming in. We'll give all of you a few more moments here. All right, let's take a look and see what all of you selected. And it looks like 37% of you selected tranylcypromine, and in second place was mirtazapine. Let's take a look and see what the correct answer is, and the correct answer is indeed E, and 37% of you got it right, so well done. This was a challenging question. If you got it wrong, don't worry, pay attention to Paras now, you'll get it right on test day. But even if you got it correct, let's make sure you got it right for the right reasons. Paras.
Thank you, Sean. Yeah, definitely a tough question here, and let's go over this. So this patient presented to the ER with fever and muscle spasms, okay? And we know that this was recently after starting a new medication. It's important to keep that timeline in track here. So she started that new medication earlier today, and then she came to the ER with fever and muscle spasms, okay? So what should we be worried about here? Well, we also know that she's diaphoretic, she has a fever, she's agitated, and she has sustained muscle clonus. So these should really be pointing you towards serotonin syndrome, okay? So serotonin syndrome, and actually on the next slide, Sean has gone ahead and pulled up a table looking at some of those psychiatric emergencies, of which serotonin syndrome is one. So any drug that increases serotonin, SSRIs, SNRIs, tricyclic antidepressants, monoamine oxidase inhibitors, okay, and we'll talk about that in just a second. So manifestations, activity, okay, so clonus, like our patient, autonomic instability, okay, our patient was also diaphoretic and hyperthermic, okay, she had a fever. So how do you prevent it? Well, avoid simultaneous serotonergic drugs and allow a washout period between them. Our patient stopped her SSRI only 2 days before starting the new drug, okay? So she was probably then started on another drug which increased serotonin levels, and as we'll show again when we get to the answer choices, the only one was answer choice E, which is a monoamine oxidase inhibitor, okay? So there was no washout period, usually at least a couple weeks, 2 to 4 weeks, depending on the drugs. But that can help prevent serotonin syndrome. So this patient likely had too much serotonin and then developed serotonin syndrome. For those of you wondering, maybe why was this not neuroleptic malignant syndrome? Well, neuroleptic malignant syndrome, that usually comes after starting an antipsychotic, okay? And there's a couple things there as well that you should be on the lookout for. Myoglobinuria, elevated muscle enzymes, and also muscle rigidity. So unlike serotonin syndrome, where you're getting muscle clonus, you actually, with neuroleptic malignant syndrome, can develop muscle rigidity. Okay, so it's a little bit of a different presentation. So let's take a look on the next slide now. Sean has actually gone ahead and pulled up a table on the various MAOIs, and you can see there that one of our option choices is there. Okay, it's an MAOI inhibitor, and it increases amine neurotransmitters, norepinephrine, dopamine, and importantly, serotonin. So you can also see there in the adverse effects that it's contraindicated with SSRIs. And as you can imagine, that's because of the risk of serotonin syndrome. It also says wait 2 weeks in between starting serotonergic drugs. Okay. So now that we know that, let's go back and take a look at our vignette and our question. Now, hopefully you can see why she had developed serotonin syndrome. She was on an SSRI, only stopped 2 days ago. Okay, she's got fever, diaphoresis, she's got muscle clonus, okay, also hyperreflexia as well. So of those answer choices, the only one that would increase the risk of serotonin syndrome would be answer choice E, which is an MAOI. Let's talk about the other answer choices and why those are not as correct answers. Answer choice D, mirtazapine, that is also an antidepressant, but it's unlikely to cause this syndrome as it doesn't increase serotonin levels like answer choice E. Answer choice C, diazepam, that is a benzodiazepine used more so for anxiety, status epilepticus, and its mechanism of action is unlikely to cause serotonin syndrome. Chlorpromazine, this is a first-generation antipsychotic. So this could potentially cause neuroleptic malignant syndrome, and maybe those of you who selected that were thinking of that. But as we talked about, there are important clinical features to differentiate between serotonin syndrome and neuroleptic malignant syndrome. And once again, those are muscle clonus versus muscle rigidity, and also looking for elevated CK or myoglobinuria, okay? And lastly, answer choice A, bupropion. That is also an antidepressant, and that works by blocking the norepinephrine and dopamine transporters, not serotonin, so unlikely to cause serotonin syndrome as well. So hopefully you're able to understand what this patient had, serotonin syndrome, and why answer choice E was the best answer here.
Well, thank you very much, Paris. We'll go ahead and move on to our second question. I love the dedication we have. I've seen so many names that I see every single week, and we have one person here on her birthday, celebrating her birthday with us this evening. So happy birthday, Karina. We're happy to have you here. And I agree, what better way to spend your birthday than with us, right? And learn and get ready for step one. So with the birthday wish aside, let's go ahead and get into our second question of the evening. Here we go. As always, we will begin with the lead-in. Which of the following neurotransmitters would most likely be decreased in this patient's cerebrospinal fluid? Which of the following neurotransmitters would most likely be decreased in this patient's cerebrospinal fluid? We'll give all of you a few minutes here to let us know in the question box how many steps you believe this question will require before we read the vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 21-year-old man is referred to a college psychiatric clinic after getting into many physical fights. He states that as a child, he was always getting in trouble for misbehaving in class. He would think a thought and then act on it before he could stop himself. On physical examination, his knuckles look beaten and scarred, and he has bruises on his arms and face. Which of the following neurotransmitters would most likely be decreased in this patient's cerebrospinal fluid? I want all of you to start thinking about the important clues in this vignette and in the lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we have a younger patient. We have a 21-year-old man, okay? So now let's start to think about, how that could change what we're thinking. So he presents to the psych clinic, and they give us some important history of present illness. They tell us he's been in many physical fights, he was always in trouble, he just thought something and then acted on it, and then they give us some important physical exam findings, okay? And then they ask us which neurotransmitters most likely decreased in the CSF of this patient. So those are the important phrases as well in the lead-in, okay? So let's talk about how many steps we think this question is. Well, I think this is probably a nice two-step question. I think one, we need to figure out what's going on with this patient. And then two, I think we need to figure out what are the neurotransmitter abnormalities in, whatever we determine number one is. So let's go ahead and take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, serotonin. D, norepinephrine. C, epinephrine. B, dopamine. And A, acetylcholine. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. So as always, we're going to wait until about 2/3 of you have responded. Keep in mind that we do have a raffle and a special offer for all of you in attendance. You must be present to win the raffle. I think last week we had a couple people who won but were not in attendance. So don't be that person. Make sure you stick around. This might be your lucky night. For those of you wondering what next week's topic is going to be endocrine. So we hope you'll join us then. A few more moments here. All right, let's take a look and see what all of you selected. It was a one. 34% of you selected dopamine and 31% of you selected serotonin. Let's see what the correct answer is. And the correct answer is E, serotonin. And that was our second most popular answer choice, with 31% of you getting it right. Another challenging question indeed, but let's make sure we understand it as Paris explains it to us. Paris.
Thank you, Sean. Yes, definitely another tough question. So we have a patient here who has been violent and has been what I would call impulsive, acting on something before stopping himself. So what are we getting at here? Well, which neurotransmitter is likely decreased in this patient who is impulsive and repeatedly violent? It's likely that he has a deficiency or decreased serotonin level. Serotonin is important in modulating and inhibiting behaviors, okay? And cerebrospinal fluid levels of this have been shown to be low in people who are impulsive and repeatedly violent, okay? It's thought to work by inhibiting some of those prefrontal mechanisms that promote aggression, okay? So a low serotonin level may be what you would find in this patient's CSF. Let's talk about the other answer choices and why those are incorrect. Norepinephrine. So norepinephrine isn't so much as related to this. Increases in norepinephrine can lead to a decrease in the ability to screen for reasonable strategies and can sometimes lead to irritability, but not as great of an answer choice as answer choice E. Epinephrine, and also one other thing about norepinephrine, if a patient were to have impulsivity or aggression, they would potentially have increased levels of norepinephrine, not decreased. Epinephrine, also those levels would be potentially increased in states of aggression or violence, so likely also not the best answer there. Dopamine, I believe that was either the first or second most highly selected answer. Dopamine is involved in motivation and the initiation of behavior, and its levels actually correlate positively with aggression and agitation. So increased levels have been associated with aggression and agitation, not decreased. And lastly, acetylcholine. This doesn't have as much of a role in those functions of aggression and impulsivity. So answer choice E would be the best answer here. So tough question, but hopefully a learning point for everyone today.
All right, well, we're halfway through tonight. Great job, everyone. We've done some challenging questions, but medical school is challenging, as is the comp, as is USMLE, as is COMLEX. And if you want help as you're trying to overcome any obstacles you may have, or you want to, succeed and reach your maximum potential, RX Coach is here to help you. What we do is we administer a assessment. We are one of the only companies that's created our own assessments and authored our own resources, such as first aid, USMLE-Rx, which includes RX 360, which includes RX Bricks, our question bank, our flash facts, and our express videos. If you're already in medical school, instead of administering an assessment exam, we will go by your syllabus and your performance in the past, and we'll create a personalized study plan so you can take the guesswork out of studying. Then we'll meet with you at regular intervals to do practice questions to make sure your study plan is working, that you're sticking to it. We will hold you accountable. And we'll help you practice doing these questions. And as we do that, we'll be able to see how you learn, how you think, how you apply what you know. So we can not only identify those knowledge gaps and bridge them, but so that we can actually work with you on a one-on-one level to increase your potential for test day. And that includes, like I said, bridging those knowledge gaps, but also helping you master those test taking skills, okay? So whether you're studying for a medical school exam, for your comprehensive exam, for step 1 or step 2 or COMLEX, reach out to us at rx-coach or rx-coach.com. Click on the free consultation tab if you're interested in tutoring or coaching, and we'll talk to you about the program and how it can benefit you. We have helped hundreds of students accomplish their goals with tutors such as coaches such as Paris and Brian, who you met today, and a lot of other ones. And we'll talk briefly about how they got to where they are now. And I'm sure you guys and all of you want to follow in their footsteps. So if you want our assistance, please reach out to us. We're here to help you in every way we can. We've had a lot of success stories. We'd love to make you one of them as well. All right. So let's go ahead and move on now to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. What is the mechanism of action of the first-line medication that is most appropriate for the patient's current condition? What is the mechanism of action of the first-line medication that is most appropriate for the patient's current condition? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to the vignette. I see the responses coming in, so let's go ahead and read that vignette. A 47-year-old man is brought to the emergency department after being struck with a beer bottle during a bar fight. He reports many unsuccessful prior attempts to get sober and has recently lost his job due to being intoxicated at work. He presents with tremors and agitation. Temperature is 38.7 Celsius or 101.7 Fahrenheit. Pulse is 112 per minute. And blood pressure is 185/105. What is the mechanism of action of the first-line medication that is most appropriate for the patient's current condition? As always, I want you to start thinking about the important clues in the lead-in and vignette as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So again, demographics, 47-year-old man. Why did he come to the ER? Well, we know he was just in a bar fight. They also give us some important medical history about how he's been unsuccessful in trying to get sober, okay? We also know he's lost his job, and then they tell us he's got tremors and agitation. They give us some abnormal vital signs. Always important to make note of those vital signs, especially when they're abnormal, okay? So then they ask us the mechanism of action of the first-line medication that's appropriate for the patient's current condition. Okay, well, how many steps is this question? I think 1, what's that current condition? 2, what's the first-line medication for that current condition? And then 3, what is the mechanism of action of that medication? So once again, we're going to try to figure out what's the current condition, number 1. 2, what's the first-line medication for that? And 3, what's the mechanism of action for that first-line medication? So a nice 3-step question here. So let's take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. So answer choice E, increase affinity of gamma aminobutyric acid receptors. D, decreased affinity of ligands to gamma aminobutyric acid receptors. C, competitive inhibition of gamma aminobutyric acid receptors. B, competitive inhibition of alcohol dehydrogenase. And A, activate N-methyl D-aspartate receptors. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
All right, so I've opened up that poll. We'll give all of you a few moments here and let you select your responses. Keep in mind that we do have a raffle at the end of tonight's session, so make sure you stick around because you must be present to win. We also have a special webinar coming up on May 19th. And the title of that webinar with Dr. Taulay and Dr. Faraz Vakaria, as well as Dr. Alec Kellish, is going to be how to create a study schedule. That link will be put in the chat box for you, but if not, you can always go to firstaidteam.com and I'll talk more about it later. A few more moments here. All right, and let's see what you selected. Looks like in first place was B, competitive inhibition of alcohol dehydrogenase. And in second place was increased affinity of gamma aminobutyric acid receptors. So let's take a look and see what the correct answer is. And the correct answer is E. And 27% of you got it right. So our most challenging question of the evening yet. Let me hand it off to Faraz so he can explain this to us so all of you can knock it out of the park on test day.
Thank you, Sean. Yes, definitely a tough question here. So let's take a look at what's going on. Hopefully you guys were able to pick up on this patient having alcohol use disorder. So a patient who has a problematic pattern of alcohol use where it's actually interfering with their daily lives. Okay, and in this patient, it's had an impact on his work, had an impact on his work life and daily life as well. So he's got alcohol use disorder. He's also demonstrating signs and symptoms of acute alcohol withdrawal. So he's got a fever, he's got tachycardia, hypertension, and he also has tremors and agitation as well. Okay, so what could we potentially use to treat this patient's condition? Well, this patient would likely benefit from benzodiazepine therapy. They're used to treat that psychomotor agitation associated with alcohol withdrawal, and it can prevent the progression to seizures or even death. Okay, benzodiazepines work by binding to that gamma aminobutyric acid receptor. It leads to a change that increases the binding of GABA to the receptor, and as hopefully you remember, increases the frequency of channel opening and thus the influx of chloride ion. So once again, it increases the binding of GABA to the receptor and increases the frequency of channel opening. Okay, so this then leads to a decrease in neuronal activity and can help calm down that psychomotor agitation. Let's take a quick look at the next slide, and on that slide, you can see that this is alcohol use disorder. So it's diagnosed using the criteria for substance use disorder, okay? And there are also some more longer-term treatments as well that you can use down the road. But acutely, you do want to talk about controlling those psychomotor agitations and autonomic signs and symptoms as well. On the next slide, you can see another table looking at drug intoxication with alcohol, okay? And you can see there specifically on that time graph there, this patient had a lot of those. This patient has agitation, has tremors, and then also has some autonomic instability as well. It hasn't developed seizures, hasn't developed hallucinations yet, but you can see there that the treatment is with longer acting benzodiazepines, and that will help with the drug intoxication symptoms, okay? So right at the bottom of that time graph, you can see what the treatment for this intoxication is, okay? So let's go back to our vignette and then take a look at the other answer choices and why those are less correct. So D, decreased affinity of ligands. This would actually lead to more stimulation of the CNS system, kind of the opposite mechanism of benzodiazepines. So not a good answer there. Answer choice C, competitive inhibition of GABA receptors. This would also lead to CNS stimulation as well. So not a good answer choice there as well. Answer choice B, I think this was the second most highly selected answer. This is getting at something like either ethanol or fomepizole, which competitively inhibit alcohol dehydrogenase, okay? They're not used in this setting, but they can be used in other settings such as ethylene glycol or methanol toxicity. Really, we want to help control the psychomotor agitation and autonomic instability that's going on. And lastly, answer choice A, this is getting at something like glutamate, okay, which can activate, bind to and activate those receptors. This would also lead to more neuronal excitation as well, though, so that wouldn't really be a great option as well. So hopefully you guys were able to pick up on this patient was having acute alcohol intoxication, and that probably needed a benzodiazepine, and then you can take it a step further and answer that with the mechanism of benzodiazepine. So tough question here, but a nice three-step question that's pretty representative of some of the step questions as well.
Excellent. Thank you, Paras. Once again, another challenging question, but we are going to have those challenging questions, right? On our exams, be it in medical school or on comprehensive or on one of our board exams. But remember, your goal is not just to pass your exams. Your goal is to become a good physician. So you should welcome these challenges because they make you better. You know, we have a lot of wonderful and highly qualified coaches, and one thing that they have in common is that they never took shortcuts or tried to game the system. And I see a lot of students come to us and say, you know, I'm thinking of waiting to take step one because it's going to be pass fail. And that certainly is one strategy, but it's trying to take the easy way out and trying to just pass. But then what happens? You have to do well on step two because residencies are going to want something to see how you compare to other people and how your scores compare. And without that strong step one foundation, you're already setting yourself up for not having as much success as you would if you knock step one out of the park. So if you want to become a good physician, if you want to get that residency, and if you look at all the math results from last year, you will see that it was one of the most competitive matches ever. Taking shortcuts now is not the way to do it. The way to do it is learn the material as best as possible, get the highest score as possible, even if it is only pass fail, because that will set you up to not only be a good physician, but also to do well on step two, which will then set you apart from the rest of the applicants and help you secure the residency of your dreams. So once again, doctors like Boris and Alec and our coaches and all these people that you see in these coveted residencies, they didn't get those spots by doing the bare minimum. They did it by being assertive, by putting their all into it, working hard, setting a goal, achieving it no matter what the obstacles were, regardless of how challenging that path was. And we're here to help you. We do these question labs every week. We have firstaidteam.com, our blog. We have free bricks available for you that Jeff will talk about. And we even have coaching services for those of you who really want to have that edge. So once again, keep in mind that shortcuts will not set you up for success. They will actually set you back. And if you think that you're going to take a shortcut now and make up for it later, playing catch up is always harder than doing it right the first time around. So with that, let's go ahead and move on to our fourth and last question of the evening on psychiatry. Next week's topic is endocrine. And as always, we have a special offer and a raffle for all of you at the end. Let's try to finish strong. Once again, we will begin with the lead-in. Which of the following medications was most likely prescribed? Which of the following medications was most likely prescribed? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we will read the vignette. I see the responses coming in. Let's go ahead and read that vignette. A 42-year-old woman comes to the clinic for a follow-up examination. She was prescribed a medication 1 month ago to treat insomnia and nervousness due to worry over her financial situation. Though she was initially prescribed a 2-month supply of medication, she has already run out. She reports that she now needs twice her original dose to achieve the same effect and does not feel well when she does not take the medication. She continues to sleep irregularly. The patient appears more anxious. She is sweating profusely and tapping her feet restlessly. Which of the following medications was most likely prescribed? I'll give all of you a few moments here to think about the important clues in the lead-in and vignette as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so hopefully by us doing this over these 4 questions, you guys are starting to get a sense of what we think is important, what's not as important to highlight, so that when you go back and take a look at that question, you'll have all the relevant, concise information highlighted, okay? And then also, hopefully you guys are also getting a sense of how many steps we also think these questions are as well. So let's take a look again. So a little bit of a longer vignette. We have a 42-year-old woman, okay? They give us a lot of history of present illness. She was prescribed a medication a month ago for insomnia and nervousness. She was given a 2-month supply, but it's run out. Then they tell us a little bit more about what she's been doing, how she's been feeling, and all important to take note of to try to come to a diagnosis, okay? They do give us some physical exam findings at the end as well, okay? So important to take note of those. They don't say, a lot of times they'll say physical exam findings demonstrate, but here they kind of just tell us that she is sweating profusely and tapping her feet restlessly. So those are subtly physical exam findings, okay? So now let's take a look at that lead-in. They're asking us the medication most likely prescribed. Well, how many steps is this question? I think maybe a 2-step question. I think 1, we need to figure out what's going on with her, and then 2, what medication or medications could maybe cause that. So I think maybe a 2-step question here. So let's go ahead and take a look at those answer choices and see what we're working with. And once again, we have 5 answer choices. And once again, I'm going to start at the bottom and work our way up to the top. Answer choice E, thiopental. D, oxazepam. C, hydroxyzine. B, diazepam. And A, buspirone. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
All right, so last question here. Let's try to finish strong. I see a couple of questions here. Is doing Qmax and UWorld enough to pass step 1? The answer is maybe. Is that what we recommend? No. Once again, these are called practice questions, not learning questions. We want to learn the material and then practice with practice questions, right? So using first aid along with RX bricks, express videos, flash facts, and a question bank, we know will work. We also know that students who take 3 passes or 3 reads of first aid tend to do better than those who do not. So keep those tips in mind, and you can find more tips online at firstaidteam.com. And of course, if you want individual tips and guidance, you can reach out to us at rx-coach.com. All right, let's take a look and see what you selected. Looks like in first place we have diazepam, and in second place we have oxazepam. Let's see what the correct answer is, and the correct answer is D, oxazepam, and 32% of you got it right. So another challenging question. Let me hand it off to Boris so we can explain the correct and incorrect answer choices. Boris.
Thank you, Sean. Yes, definitely a tough question. We've had some tough questions tonight. So let's take a look at this question. So what does this patient have? She's sweating. She's had some changes in her sleep, and she has increasing anxiety, even though she was started on a medication to treat her anxiety. That's interesting, right? So it's likely getting at maybe she's becoming dependent on this drug, okay? Drug dependence. So this patient may have been started, and actually likely was started, on a benzodiazepine, okay? So she's exhibiting signs and symptoms of benzodiazepine dependence. And if we had to pick one, we would pick one that's shorter acting, okay? And that would be oxazepam. You're more likely to get dependence with short acting agents or those with shorter half-lives, okay? And this is one of the reasons why they're not commonly used as much for treating anxiety disorders, okay? Usually we stick to drugs that have longer half-life, like SSRIs, okay? But sometimes they can be used as a bridge in the first couple weeks while that SSRI is starting to kick in, or even just as an adjunct for certain situations, okay? So even though they are effective for anxiety, that potential for dependence and tolerance as well make them not as great options, and they have to be used with caution, okay? So on the next slide, Sean has actually gone ahead and pulled up a table from first aid looking at benzodiazepine, okay? You can see there under mechanism, it says most of them have long half-lives and active metabolites except for Adam, alprazolam, triazolam, oxazepam, and midazolam, okay? As a result, they have higher addictive potential, okay? So what are some adverse effects? As it says there, number 1 is dependence, okay? So one of the main side effects of benzodiazepine use, especially with those Adam or short-acting benzos, is dependence, okay? So let's take a look back at our vignette and questions again. Let's take a look at the other answer choices, why those were not as good. Thiopental, answer choice E, that is a barbiturate. That's used more for induction and an adjunct for anesthesia, okay? Not really used for anxiety and not really used in the outpatient setting either. Hydroxyzine, this is an antihistamine used more so for treating pruritus, okay? It can be used a little bit for calming anxiety, but not too much. So not a great answer choice there. Diazepam, you could be thinking about diazepam in terms of benzodiazepine dependence, but remember, that's a little bit of a longer acting benzodiazepine, okay? So less likely to be one of the culprits for benzodiazepine dependence. Lastly, answer choice A, buspirone. This is also an anxiolytic agent as well, but it also has a very slow onset of action, takes a few weeks to work, and thus also is not a likely culprit for this patient's signs and symptoms of drug dependence, okay? So hopefully you guys were able to understand what was going on in this question. Hopefully overall you guys were able to see how they like to ask some of these psychiatry questions and how to tackle them as well.